Hi, it's Brad Clark, and in this video, step 7, I'm going to help you plan for potentially high long-term care expenses. So what is long-term care? It's services to assist the elderly with activities of daily living, like bathing, dressing, or eating. So long-term care is very common. According to the Department of Health and Human Services, almost 70% of us are going to need some type of long-term care after age 65. That doesn't mean we're going to end up in a nursing home for 5 years, but we're going to need some type of long-term care, 70%. Long-term care can be expensive. In Massachusetts, which is a state where a lot of my clients are, the median cost of a private nursing home room is over $150,000. It's $153,000 according to a Genworth survey. Not all of them are this expensive. Some are more expensive. Again, you may not end up in a nursing home, but if you did, it could run 153 grand a year. So 5 years in a nursing home at that rate would be $765,000. And the next obvious question is, does your plan comprehend that type of spending? Can you afford that? Another incredibly important point is that long-term care expenses are not covered by Medicare. Long-term care is not healthcare. You may think of it as healthcare, but it doesn't count as healthcare from a Medicare perspective. So what are your options for managing this risk? Well, earlier on in one of the earlier videos, I stepped through your choices for managing risks in general. You can try to avoid the risk. You can assume the risk, or self-insure, if you will. You can try to mitigate the risk. And in this example, mitigating the risk may be, let's say your spouse needs long-term care. Well, you could take care of your spouse instead of paying an assisted living facility or a nursing home to do that. So that might be an example of mitigating the risk. A lot of people try to do that, but they're not necessarily able to do that, and it can be very difficult. So mitigating the risk, maybe you'll be able to do that, maybe you won't be able to do that. The last thing you can do is transfer the risk to an insurance company, right? Buying insurance for this. So the central question is, should you purchase long-term care insurance? The wrong way to decide is with your gut, or to let an insurance salesperson scare you. The right way to decide is to do some analysis. So take two couples, the Smiths and the Millers. Both have strong financial plans. So when we use financial planning software, we score our plans with a level of confidence. And it's basically calculating how likely is the plan to be successful under different stock market scenarios. So let's say the Smiths and the Millers both have a plan confidence of 90, which is very high. Now you can run a what-if analysis. It says, what if we have a significant long-term care event in our plan? What does it do to our plan's confidence? So for the Smiths, let's say that we run that analysis and it reduces the confidence of the plan from 90% to 85%. Well, the Smiths' plan is therefore resilient and they can self-insure for this risk. The Millers' plan is vulnerable, however. They had a 90% confident plan, but when we run the analysis for them, it drops to 55%. So their plan is vulnerable and they should consider insurance. So again, 90 to 85, 90 to 55, Smiths self-insure, Millers should at least consider the insurance. If you do consider the coverage, here's your first decision. There's two types of plans. There's a standalone plan, which is simpler, where you're just buying the insurance. It costs you a few $1,000s a year. Or there's a hybrid plan, where what these insurance companies have done is they've taken a life insurance policy or an annuity contract, and they've added a long-term care rider to those contracts. Those are legitimate vehicles. I tend to prefer the standalone plans because they're simpler. And I like to make the premiums as low as possible. So I did some research in preparing for this video, and it appears that the cost of every $100,000 of benefit that you get runs between $500 and $2,000 per year for that level of benefit. And that's a function of your age, your gender, and your health, because there is medical underwriting for these policies. So we just covered the risk of long-term care and a framework for thinking about whether to purchase coverage or not. In this next video, step 8, I'm going to dive into this incredibly important topic of taxes and how can you make tax decisions to optimize your wealth.